If the patient has fairly severe tightness in the neck or back that greatly inhibits movement, this is often due to excess cold or dampness in the channel. Redness and boils indicate heat and blood congealing due to a lack of lively bladder chi transformation. Okay, let's try to look at your bladder 40. So if you see visible capillaries behind the knees at bladder 40, this indicates blood stasis in the bladder channel or DO vessel. Observable signs along the channel do not always mean that the bladder is an important part of the pathodynamic. For instance, if you see small reddish papules or cysts along the bladder channel in the area between T3 and T7, this might indicate heat from constraint in the upper burner, which includes the lungs and heart. Small red papules on the lower back may indicate heat in the large intestine, a sign seen in patients with chronic inflammation or hemorrhoids. There are no special areas for palpating pulses along the bladder channel. Any nodules, tenderness, weakness, or increased muscle tone on the back shoe points indicate some sort of dysfunction in the associated organs. Because of the warm, yang nature of the Tai-Yang channel, it is more likely to involve yang or qi deficiency. Because the area is also in close proximity to the yang nature DO vessel and its collateral vessel along the important Huato Jiaqi points, a wide variety of palpable changes can be found in the area. It is most helpful to keep the organs associated with each of the back shoe points in mind when you find changes along the bladder channel on the back. Tenderness at bladder 64, the source point of the bladder, indicates qi deficiency of the channel. This is seen in chronic back pain. So if a patient complains of chronic back, if you feel some tenderness at bladder 64, the patient might have chronic back pain. Also, in cases of chronic back pain where blood stasis is involved, there may be small, relatively hard nodules in bladder 64. The chi cleft point of the channel, which is bladder 63, is reactive and very tender in cases of excess. Palpable change at bladder 63 indicates stagnation in the channel. Common symptoms, acute back pain. So if we feel some, or if we palpate some tenderness on bladder 63, it could be acute back pain, together with Tai-Yang channel headaches, or there might be urinary or kidney stones. Weakness or tenderness at bladder 60 indicates cold dampness in the sinew channels of the bladder, because bladder 60 is also the influential point of the yang chow vessel. Tenderness may indicate involvement of the sinew channels of multiple channels. So here we see the points that we have discussed. Sinew problems may involve increased tightness or thickening of the fascia in the area between bladder 57 and bladder 58. This may include acute low back or neck spasms and or tightness. For acute back sprain, bladder 40, the command point of the back, will show nodules, distended vessels, or tightening of the surrounding tendons. So tingnan niyo yung bladder 40 nyo, baka may mga ma-feel kayo na nodules, distended vessels, or tightening. So that patient must be experiencing acute back sprain. In patients with chronic back problems, the area will look puffy and will feel quite soft when cold accumulation in the bladder channel is part of the pathodynamic. So nodules may also be found sa bladder 40 in bladder type, which is occipital headaches. No? Because this is a uniting point on the channel, we will feel palpable changes or small visible blood collaterals in the case of counterflow in the bladder channel. Counterflow in the bladder channel is seen in cases of summer heat, that include nausea, vomiting, and headaches. In such cases, a few drops of blood should be directly removed from any visible blood collaterals. There may also be visible blood collaterals that should be bled in cases of hemorrhoids. Okay, so here you see the points. Bladder 57, bladder 58. When there is, and bladder 40, right? When there is a tumor or enlargement in one of the internal organs, the area between bladder 36 and bladder 37 may have deep nodules or tenderness when pressing deeply. So press nyo na yung bladder 36 nyo, the area between bladder 36 and bladder 37. Kung may find out if you have deep nodules there or may tenderness when you press deeply. So I hope you could do it now. And good luck. Okay, so to summarize, if we've, tenderness. Okay, for the back shoe, back associated points, you observe tenderness, nodules, softness, or weakness, no? So if there is tenderness, there could be deficiency or inflammation affecting the organ in associated area. So kung may mga nodules, this could be a chronic organ condition, may involve physical organ changes. If there is softness or weakness, there could be yang deficiency affecting the associated organ. Now, the area along bladder 36 and bladder 37, if you want to know if you will have some inflammation or tumors in the organ, you would feel some nodules or some tenderness there. Then if you see capillaries, okay, in bladder, there could be hemorrhoids or stasis in the Taeyang pathway on the back or summer heat, no? Along bladder 40. Nodules, tightness or thickness, nodules, you will feel you will have occipital headaches, counterflow affecting the bladder channel. So if you have tightness or thickness of the bladder 40, you can have tightness of tendons throughout the back, inflammation in the channel. For bladder 57, bladder 58, if there is tightness or thickness, back neck spasms due to Taeyang stasis.